Hello and welcome to Public Health News. Today our topic is about the diabetes epidemic amongst the Aboriginals. There are 1.17 million Aboriginals in Canada. They make up 3% of the population, and they are facing a diabetes epidemic. Thus, there is an increasing need to look after their needs. Let's go live with Jane for more on the topic.
Thank you, Mary. I am here with Bob, who is a diabetes specialist. Hello, Bob.
Hello.
So what can you tell us about the Aboriginals?
Well, for one, they have a prevalence of diabetes rate that is 3 to 5 times higher than non-Aboriginal populations.
How is that possible?
Well, historically, Aboriginal populations led active, healthy lifestyles that were free of diabetes and chronic diseases. This was due to the fact that the daily activities included hunting and gathering food. However, the adoption of the modern lifestyle resulted in a sedentary lifestyle behavior and alterations in diet. A sedentary lifestyle with a constant consumption of nutrients can lead to the development of diabetes.
What are the risks of developing diabetes apart from having a sedentary lifestyle?
Well, that would be age, genetics, high blood sugar, dark patches, high cholesterol, high blood pressure, and obesity.
What more can you tell us about diabetes?
Well, diabetes is characterized by low or high blood sugar. There are 2 types of diabetes. Type 1 diabetes is also known as diabetes mellitus, where the body doesn't produce enough insulin to manage the sugar level in the blood. Type 2 diabetes is characterized by the body becoming resistant to insulin.
What are the complications and symptoms of diabetes?
The symptoms of diabetes are increased thirst and frequent urination, increased hunger, weight change, fatigue, blurred vision, slow healing sores, or frequent infections, and dark skin patches.
Wow, that sounds pretty serious. How is it treated?
Well, it is treated with insulin therapy, medication, physical activity and proper nutrition.
That's all the time we have. Thank you, Bob. Back to you, Mary.
Now we will go to Sarah for more on this epidemic.
Thank you, Mary. I'm here with Joe, from the Aboriginal Diabetes Initiative. Hello, Joe.
Hello.
So, Joe, can you tell us about the action plans and primary prevention procedures?
Well, in Canada, there is something called the Aboriginal Diabetes Initiative, and we aim to reduce diabetes among Aboriginal people by supporting health promotion and primary prevention activities. We implemented primary prevention procedures such as community-based health promotion programs, including healthy eating, diabetes awareness, education, and promoting physical activity in daily living.
What can you tell us about secondary prevention?
Well, for secondary prevention we have placed a series of steps, such as screening and diagnostic testing. Then we promote physical activity and healthy eating as a way of stopping or reversing the process. Aboriginals believe in a sense of community, so targeting community-based interventions would be a good idea. We also encourage people to fill out their can-risk questionnaire.
But what about those who have been living with the disease? What about tertiary prevention?
Well, for tertiary prevention, we aim at preventing the disease from progressing and managing complications. Complications can be high blood sugar, increased urine ketones, hyperglycemic hyperosmolar syndrome, and low blood sugar. So we set up programs that aid with management, such as education on how to cope, monitoring blood sugar level, walking clubs, fitness classes, strict nutrition for complications, and drug and insulin therapy. Of course, to ensure greater efficiency, all these programs are based on a partnership with provincial and territorial governments, First Nations organizations, Inuit community groups, and the tribal councils.
What are some barriers that get in the way of implementing these programs in the Aboriginal community?
That would be the availability of resources, cultural barriers, and lack of knowledge.
Thank you for your time, Joe. Back to you, Mary.
Thank you, Jane, for this much needed information. Now, before we finish, let's talk about the 2014 North American Indigenous Games, which will be held in Regina, Saskatchewan. It includes traditional events such as archery, canoeing, and kayaking. The overall vision and goal for the 2014 North American Indigenous Games is to promote a healthy and positive lifestyle within the indigenous communities all across North America. Diabetes is a complex problem, therefore there is a need to address the issue by collaboration and the inclusion of the community as a whole. Thank you very much for tuning into our broadcast. I am Mary, and on the behalf of everyone from PHN, good night.